All right. Well, I've been getting a lot of questions about treatment of GERD. What is GERD? Well, GERD is acid that is refluxing back up into the esophagus. And so the question then comes up with that, well, what causes it? And there can be a number of different things that can cause acid reflux and GERD from that standpoint. One of the most common ones that we run into is a hiatal hernia. And that's basically where the natural little opening in your diaphragm gets a little bit wide. And as the esophagus comes down, that stomach is able to move back and forth a little bit. The sphincter between the stomach and the esophagus gets up above the diaphragm. That can then make it easier for you to reflux, and that changes the pressures in the stomach and in the esophagus, causing acid to come back up. Sometimes that manifests as heartburn. Sometimes GERD, though, is not heartburn, but rather something that we call laryngopharyngeal reflux, or LPR for short, where you can get little microparticles of acid getting all the way up into your upper airways, where you may get a chronic cough or throat clearing, or you may feel like you've got allergies, even when the allergies are not in season. Now, there are different ways that we can treat this. With minor cases, we can often treat it with medication, which will reduce the acid levels within the stomach. For some people, that's not quite enough, and that doesn't quite fix the problem. And we do have surgeries that can address that can involve fixing a hiatal hernia, can involve different ways in which we can increase the pressure around that sphincter between the stomach and the esophagus to prevent reflux from going back up. One of the things I do a lot is something called a LINX procedure, where I can put magnets around that sphincter between the stomach and the esophagus. We've got a lot of different treatments, but the key is we have multiple options and things we can do to help treat this. So this isn't something that you feel like you have to battle alone. If you've got questions about it, call us, make an appointment. I'll be happy to go over these treatment options with you.